What exactly is shock? It's a clinical condition where organs start dysfunctioning because there's an imbalance between demand and supply. Everything in the body is demanding. So if the supply of oxygen that needs to be given is different, the demands are different, and these demands are not met, then that is shock. Again, as I said, this imbalance can be because of reduced oxygen delivery or increased consumption of oxygen or inadequate utilization of oxygen or any of this form. We have different things. You are hypoxic, you are not able to get much oxygen, there is less delivery. You're running very hard, your your heart is running hard, your muscles are working hard, they need a lot of oxygen, but your lungs are not able. Or then in special poisonings and like cyanide poisoning, or in case of sepsis with cytotoxic edema or cytotoxic poisoning and all, and dysfunction at the cytotoxic ETC level, oxygen is there, but you are not able to use it. This is what shock is all about, and that's why I said this is a better word to be used and better definition than when we talk about hemodynamic system. So there are different types of shocks we have read in textbooks we have had during our classes in MBBS and MD. We have a distributive shock. We have, as the name suggests, it's because of problem with distribution of the fluid. The volume is there, but the distribution is screwed. We have a hypovolemic because of less volume in the body, cardiogenic because your pump, that is the heart, is not working, obstructive because the pipes have been blocked and the blood is not going in the forward direction. Any combination is mixed, and sometimes you are not able to pinpoint which type of shock. So in distributive shock, we have septic shock, any inflammatory process which causes decreased delivery because of vasodilatation state is distributive. Because of vasodilatation, let's say 5 liters of blood now has to occupy a space of 7 liters, which is not possible. What we end up with is distributive shock. We see in cases of pancreatitis, septic shock, burns, anaphylactic, neurogenic, endocrine crisis. Those who've been working in the ICU won't be strangers to these terminology. Hypovolemic is because the circulating volume is less. That's why the cardiac output and the oxygen delivery is decreased. Basically, there is no preload. There is no supply going into the heart or less supply going. So mostly dehydrations, hemorrhagic shock, losses in GI, diarrhea, vomiting, poor oral intake, burns losses, polyuria. These are some of the states which cause hypovolemic. Then when your pump is dysfunctioning, it is because of a problem related to the heart. So that's why we call it cardiogenic shock. And because of lower cardiac output, there is less delivery of oxygen. Myocardial infarction, myocarditis, arrhythmia, or valvular lesions can lead to this sort of a shock. Then obstructive, as I said, because of an extracardiac process or any obstruction in the pipelines, you are not able to push forward the blood. So heart is okay, volume is okay, the SVR is okay, but the blood is not. So tension pneumothorax, cardiac tamponade, pericarditis of restrictive morphology, pulmonary embolism, aortic dissection are some of the things that affect in a mechanical way. Then mixed, as I said, is a combination, and undifferentiated is where it's not very apparently clear what is the type of disease process we are dealing with. And believe me, quite a good number